Well, everyone, welcome back to We'll Work for Podcast. As always, I'm Daniel Thornton, joined by...
Brendan Boland.
Forgot there for a second, did you? So Marie, what an interesting interview that was. I really didn't see where that was going in the beginning, like how it was going to connect back to work, and like that's where we were trying to say. But I will say, I had an interesting experience with finding my color orange, as she stated in like the interview, and that was me trying to go through my review and think of all the good things I've done within the last few months. And it's really weird because I don't think intrinsically for me, I don't know how other people function in their jobs, but I usually focus on the bad stuff and not the good stuff. Like, oh, I did this really well. It's more of, oh, I did this wrong. And so that's all that matters. Like the good stuff really doesn't matter. You know what I'm saying?
Like you fixate on the things that you want to change.
Right. I fixate on the stuff that I want to change or that I don't think is perfect or things along that nature. Like we've talked about this before in the past, like being a detail-oriented person, I struggle with that. So and my boss really did a good job of pointing this out. Is like, let's be cognizant of pointing out when you did something that was good, that was detail-oriented, which is hard because it's kind of supposed to be the ghost in the background. Like if you do it well, nobody notices, but if you don't do it, then everyone notices. So, yeah, that's I thought about that a lot this week.
Yeah, positive praise has a big impact, especially if you normalize that within a team. I feel like that's kind of what you're talking about a little bit, even for yourself.
Right.
I mean, I didn't try the exercise though. I was trying to think about like what color would represent kind of my space, right? I get with Marie, like she was talking about orange because she really like that's her vibrancy in her space.
Right.
Mine is probably a little bit more of like this like blue, green, aqua kind of thing. But it makes me think about when we went into lockdown a couple years ago and the difference of our home. We started to plamp. It doesn't matter. We got a bunch of like, the flora of our living room space. Anyways,
you jungleized your living room space.
Yeah. Okay. Everyone should check out the disclosures set the beginning of pandemic versus the end of it. And it was funny because they literally just like the ferns and the tall trees, right? I know that a lot of people did that, but that's like the first thing that I thought of when she was talking about that example of, surround yourself with things that bring that sense of joy and brightness and whatever, and especially in your environment. So, if y'all have a desk, add a cactus, that's all I'm saying. Really low maintenance.
Yeah.
Or pathos. I like pathos. Really good oxygen.
Well, I guess that's a good segment into our rejection letter of the week, because this is probably more of a black color. I'm looking at this if you're identifying your rejection letters. And so I would say that here's our rejection letter of the week. It comes from Reddit. It was posted by You Lay Down Larry, and it says, "Dear blank, thank you for your interest in our social media manager position in our Beverly Hills office. We regret to inform you that we have filled this position. We appreciate your interest and opportunities with us, and will retain your information to consideration for future openings. We wish you the best of success in your employment search. Regards, Human Resources," and it actually does say company name. Like that's the so it's a form letter that they didn't even bother to change. So the guy said it was just lazy, and I agree. I don't know where he was in this process, but that is kind of lazy. At least put the like signature at the bottom of the name that we know it's a real person and not just spit it out by a machine.
It's a word template that you can just like, file save as.
But everybody out there, like and subscribe. Send us your rejection letters. We'll work for podcast@gmail.com. We have a new landing page, a new website. Check it out. It has all our information. We're on Instagram, Facebook, TikTok, whatever it is. Make sure you interact with us, and on with the show.
We're joined this week by Talaya Dendy. She's a personal cancer doula who helps people that have been diagnosed with cancer navigate their cancer journey. And so that's done, I like how she writes this, by bridging the gap between the medical and emotional sides of their cancer and their experience and their healing. She's the founder of On the Other Side. She hosts Navigating Cancer Together podcast, and her story has been published in the anthology I Survived Cancer and Here's How I Did It. 35 cancer survivors share their journey. So thank you so much for bringing your being and your work into our space today.
Thank you so much for having me, Brendan. It's a pleasure.
And certainly we're not going to ask you necessarily directly about your lived experience with cancer, but recognizing that you are a cancer survivor yourself. I am curious, from my understanding, I've always thought of doulas as those that are ushering newborns into the world or supporting, women who are pregnant on either, pre-pregnancy, during it, or after. So I'm curious, like, with the term and title of Cancer Doula, like how that came about and what's the mindset with that title?
Absolutely. I love this part. I love explaining it because that's a question I get a lot.
Okay.
And you're right. Most people have heard of birth doulas. And so originally when I started, I was calling myself a cancer coach. And the more I started interacting with people, the more I started helping people and working with people, I said, I'm not coaching people. What I'm doing is a little bit more personal. It requires more vulnerability and things of that nature. And actually, I'm walking with the clients that I support. So I had really dug into the word doula. And doula is a person who helps another person through a major life change or significant health related experience. That is definitely cancer. And so that's why I started calling myself a cancer doula, because I'm walking with the people that I support, letting them know that they're not alone. And it's not a one and done kind of thing if that's not what you want. Of course, you can meet with me for one session, but my hopes and where people will get the most benefit is if we work together for a period of time.
Yeah. So I guess, I think one of the things you write about is being kind of a healthcare advocate and in this way. So like, I guess I'd be curious, like, what does that look like? Either the customization that you're doing for your clients, or even just like, what is the spectrum of care that you're providing?
That's a great question. So, first, I'll start off by saying that I work with people virtually, and I provide support in some key areas, and they are health, first of all, which could be nutrition, exercise, things of that nature, making sure people that are doing the best that they can on their end to heal from the cancer. And then also create a certain lifestyle that they continue on after cancer and hopefully remain cancer free after the treatment. So, health, and a very important piece when someone is diagnosed with cancer and just in life general is mindset. That is something that we work on as well. A lot of people, and it's normal, it's a natural, they get this diagnosis and they become depressed, full of anxiety, overwhelmed, all of those things. So, working on mindset early and often is very important. The other piece is communication. And we all know that we're not given a manual about how to talk about cancer. So people tend to shy away. They don't know what to say. They say weird and awkward things. And so just helping people with that communication piece. That could be with their worker, where they work. That could be with their healthcare team, their family, friends, all of that. The other very important piece is helping people to understand their treatment options. And I don't diagnose, I don't tell people what their treatment options are. We talk about what their oncologist and healthcare team has provided to them, suggested, that they look at. And we dig really deep in that and figure out what is the best option for them. So, in that sense, I am doing the research for them. We talk about it. And then it's empowering them, giving them the credible information to make decisions that are best for them. And then also that includes, helping them with health insurance, medical bills, figuring all of that out, and even talking to their provider if they need that. So going to them to their appointments and things like that, making sure they understand what is being said and making sure they're showing up and advocating for themselves.
Yeah, I could see the benefit of that is like you've had this diagnosis or this reality enter your life, and I know if that was going to happen to me tomorrow, I wouldn't have any idea of where to start. And so having someone that's gone through that process already and can be that kind of champion for me or with me um, would be really powerful. And I guess my thought to that is just like, at what point in your own experience, either during or after, did this idea come to you? Like, when did you kind of know or start to build this idea of like, this is what I could offer people who are in this moment of need?
I would have to say it really came after. During, I was paying attention to the things that I needed that I wasn't getting or that weren't available. But going through it, I was trying to get through it.
Yeah.
So once I got through it and I was evaluating my life along the way, it became apparent that maybe one of the reasons why I had to go through this was to help other people. I'm a helper by nature, and I always say my purpose found me in this case. And so I would have to say after, when the dust settled, is when it really became clear that, hey, this is what I'm supposed to be doing.
I'm really interested in this model that you're talking about too, because you just said, "Oh, we do it virtually." Is that due to the pandemic that you've learned this virtual model, and has it helped? Like, are you able to reach more people because you're able to do virtual meetings?
Initially, I started out as virtual. I did offer the option for people who were local to go into their appointments with them, but
Mm.
really it's always been virtual. And then to answer your other question, it does allow me to reach more people just because people can pull out their phone, they can pull out their iPad, laptop, whatever, and get the support that they need. There's no barriers to transportation. There's no barriers to, having to maintain a certain distance because compromised immune systems and time. You can hop on Zoom or whatever at pretty much any time. And so that's a piece where a lot of people feel like they're getting limited support is only being able to talk to their doctor, their nurse navigator, their patient navigator within the confined times of business hours. And so being virtual allows me to reach people when it's convenient for them.
Yeah, that's a really big piece because my partner, she works in journalism, and she's worked with like the virtual healthcare, because I know that's like a big push now. And so, do you feel in that space like are you hoping that this trend continues? How do you feel like this should be in the future? Like your work, like where do you see this developing?
I do hope that it continues and it should be a standard of care because everyone does not have transportation. Everyone does not have people to go with them to their doctor's appointments. Everyone doesn't understand doctor speak, and I think it's needed, it's necessary. And I've been told that as well. So I really would like for it to become part of the healthcare model and be more acceptable by hospitals and clinics and things like that. Because one thing I want people to understand is that the work that I do, I don't replace anyone in anyone's healthcare team. I am complementary to. I'm an
Mm.
addition to, and my focus is on my clients and making sure that, hey, they are getting what they need. And so I really believe that in the future, this needs to be a part of standard of care. And there needs to be more reciprocity between the work that I do and the healthcare system.
Yeah, I could see that is almost like a case manager of sorts, but within this kind of more holistic approach to what the healing process can be.
Mm.
Yeah, I mean, for you personally, like what has been maybe part of your learning journey as you've entered into this professional space?
Well, the main thing, Brendan, is that it doesn't happen overnight. It involves a lot of networking and things like that. Referrals are really key and word of mouth. Really having good listening skills is critical because a lot of times it starts with cancer, but it evolves into other things that are impacting a person's life, and those things don't come out right away. So you have to spend that extra time with people. And then also, what I'm finding is that, yeah, you can market, you can get on social media. I do all of those things. But for me, it's something that is evolving organically.
Hmm.
And for some people, that may not be the route that they want to go. But it's good to have, some other work that you're doing as well while you build your clientele.
So is that kind of like patience and faith is kind of what, yeah.
Patience and faith, those are the key words. And standing in your power and knowing your purpose and keeping your why in front of you 24/7.
Hmm.
So I'm assuming that you have a lot of clients that are from various different backgrounds, beliefs, faiths. How do you deal with those kind of, I don't want to say obstacles. They're just like differences between opinions when you're trying to give, you're not, and you don't give medical advice. You're helping
Right.
to try to filter it so they understand. And then do you help them filter their understanding of what's going on, or help them, what am I trying to say? Basically, deal
And
with their emotions and in other different ways from their different cultural backgrounds. I'm just really, really interested in that.
mhm. And so it is important, again, to take the time to get to know people. And it's like you have to put in the effort. You can't make it about you.
Mm.
And you made a great point. I don't make decisions for them, I don't tell them what to do, but we just have this conversation. And that's where things come up. This is a space where they can talk about things that they normally wouldn't talk about with their family, their friends, their doctor. It's their fears, it's their worries. It's, you know, I'm afraid I'm going to die and I want to do this in my life, but I've been afraid. And there's all these different things. And so I have to take it on a person by person case. What I do to help one person may not help the other person. And so it takes time. You have to develop those relationships. Now, there are people that come to me and say, hey, I want to research this clinical trial. We do that together and we're done. There are people that I've had as clients for 3 months or more. So, in those instances, in those 3 months or more, that's where the real magic happens because I'm able to, learn about them, learn more about their background, and then customize my help around who they really are.
Yeah. What is a typical intervention time then, or time that you have with most clients?
I say typically I prefer to work with clients for 3 months,
Yeah.
at least, but I do have options where, like I said, it could be one hourly session. And of course, they can come back if they'd like to. And then I have a 1 month option and then the 3 month option. I don't like to go too much beyond 3 months because sometimes it's hard for people to even see that far.
Well, then what for the person who's just calling you for the first time, can you kind of take us through what that conversation looks like? Because that seems like a lot to cover in a very short amount of time, and I'm
Yeah.
curious how you handle that.
Mhm. Well, first of all, it starts with a free 30-minute call.
Hmm.
And during that 30-minute call is where we start to talk about what are like the top two or three things that you are having challenges with. And then whatever they share with me in that conversation, that's where the first 1 hour call, I build on that. So by having that 30-minute call, if they choose to work with me for, say, 1 hour, one session, after that 30-minute call, I go over what we've covered. And then based on that information, I develop a personalized plan for them. And then in that hour call, I listen some more. Hey, what else do they want to add to this 30-minute conversation that we've already had? And then that allows me to further build out this customized plan for them. Then there's a follow up email and a follow-up text message to the 1 hour call. And then that's making sure that, hey, they understand what we covered and they're taking action.
What is something that people do that you feel is like an oversight or a mistake emotionally when, dealing with this extreme situation that they're going through? I'm sure you've seen a lot of experience with how people have made mistakes when they're like, oh, I'm going to do it all alone, or do they try to do things that they shouldn't do? I'm really curious.
Mm-hmm. Well, there's a lot there. First of all, like you said, thinking that they can do it alone, you can do it alone, but it's going to be a lot harder. I don't recommend it. Always, even if you don't work with me, find someone that you can trust that's going to be there to the end with you, because there's going to be those tough days where you just want to give up. And you just need someone to cheer you on. You just need someone to sit with you, to listen non-judgmentally. And so that's very important, is to not try to do it alone, and you don't have to. The other part is there's still this stigma surrounding cancer. And by that I mean people hear cancer and they immediately go to death.
Mm-hmm.
And it's understandable, because that's what we hear and what we've been taught when we hear about cancer. But I like to encourage people to say, hey, this is a very big challenge in front of me. What do I need to do to get on the other side of this? Where do I need to start? What makes the most sense for me as an individual? And so I think that's where people really need to start. The other place where people make mistakes is, just having this defeatist, feeling defeated immediately, feeling like they don't have any control. And it actually starts up here. It starts with how you think about things, and mindset. The mind body connection is so important, because if you're depressed all the time, you're angry all the time, you're just down all the time, that is suppressing your immune system. So I'm not saying pretend like you're happy, positive, all these things. What I'm saying is work through those emotions and try not to get stuck there, and focus on what you can do.
Does that end up having kind of a affirmation practice or a way to kind of build in this optimism? It seems like depending on how things progress, that could be challenging.
It can be very challenging. And yes, affirmations are very important. Even in my own cancer journey, I created a healing journal where I read daily healing scriptures. I have affirmation cards. I encourage the people that I work with to do journaling and things like that to build up that emotional strength, because it's not something that's going to happen right away. Um, Everyone handles it differently. Some people, it takes more time and more effort. Some people, they just step into that right away. And it really just depends on the person. But affirmations, journaling, prayer, whatever works for that person. And we'll find out what that is.
Yeah, that's beautiful. And I really appreciate the ability to make that so personalized, because I get that that's an important step. Something you just said sparked my curiosity. We talk a lot about workplaces and really figuring out how to reshape workplaces to make them more inclusive, responsive, just affirming all the things that people are needing from that community and environment. And you mentioned one of the things that you talk with your clients about is possibly the critical conversation of addressing this with the workplace. And I'm just curious, from what you've experienced or what you've worked with clients on, maybe even your own, how does that conversation go, and what are the big factors in terms of that being a positive response that feels supportive, and maybe one that could be a challenge?
Well, that goes back to understanding the person's environment, the client's environment. And if people have a very supportive work environment, it's easy to create these scripts, and that involves knowing ahead of time, how much do you want to share with who? When do you want to share it? Do you want to share it right away? Do you want to wait until you start treatment? those kinds of things. So thinking about all of those things up front is very important, and it helps to reduce the stress. Now, if you have a work environment that's somewhat toxic, you don't have a good working relationship with the people, that you work with, then hey, we need to create something that's more soundproof. Maybe you want to start with just your manager and say, hey, I'm sharing this with you now. I don't want to have this broadcast right away, and just setting those boundaries. So, setting boundaries, making sure the person, that my client, is comfortable sharing what they want to share and when, how much they want to share, and helping them to feel empowered and say, hey, you have the right to share this with whoever you want, when you want, and on the basis that you like to share it. And that's what that portion looks like.
That's really interesting because, and now I want to kind of ask a similar question because we talked to like a grief counselor just like last week, and we were I asked the question of does somebody usually quit their job when they've suffered this dramatic loss and they push it to the side. I was expecting to hear yes, they usually just get rid of their job and like they try to start something new, and I heard this opposite. And now I'm curious for those that you've counseled, that you've been able to speak with in your clients. What happens with their job? Do they usually quit? Like, what have you seen in your experience?
I've seen a lot, and I'd have to say it's like 50-50. There's some
Mm-hmm.
people that they get this awakening and they say, hey, I've had to stare death in the face, so to speak. I've had to go through all these different things. I want to live the life that I want to live, and I want to do what I want to do. The work that I was doing is no longer fulfilling. So there's those people.
Mm-hmm.
Then there's the other people who say, my workplace, I really appreciate it. I missed it when I was out, getting treatment or on disability, whatever that looked like. Or they may say, they were very supportive. I really felt valued. I want to stay there. And so it's like 50-50. For me personally, it was something where I knew that the career I was in prior to being diagnosed with cancer was fizzling out as
Mm.
far as feeling fulfilled. Cancer and my experience, that just shined more light on it and said, hey, it's time to make a change. And so for me, I left, not right away, but I ended up leaving eventually. And so it really depends on the person. And I've seen some in between also where people reduce their hours. They stay, but they say, you know what, I don't want to devote 40 to 60 hours a week. I want to have some time to spend with my family, friends, and focus on the things that are important to me. So it really depends on the person.
And is there a policy piece that gets tied to that? Like, have you seen policies within these workplaces that are best suited to allow for that kind of that choice?
Yes, I've seen where some workplaces say, hey, we're going to support you however we can. Just let us know what you need. And I've seen workplaces where they say, you know what, we need someone here in a full time role. So
Mm.
we can either put you over here or, let's look at your other options. And it's unfortunate because I have heard a lot of stories where people have struggled in the workplace. They've left because they felt forced out. They've left because they felt like they were no longer valued. They were looked at as a liability instead of an asset. And so it really, really depends on the corporate culture, the culture of that particular workplace.
Yeah.
Yeah, that's a really good question because we talk about it all the time, like the support, like mental health, the lack of mental health resources and inside of companies and all those things really just takes a toll on you. And I can imagine you going to your boss and being like, I have cancer, and they're like, well, we kind of need somebody who doesn't have cancer. And it's like, come on, man. Like, I'm in like the worst possible moment in my life. So yeah.
Yeah.
How do you help? I was gonna ask you this before. You talked about like affirming, um, like affirmational exercises that you could do. What's an affirmation exercise that somebody can do? I'm sure it can be applied to like everyone to help them like really, get through hard times.
Hmm. And so, one thing that I ask my clients to do is start the day, looking in the mirror and talking to themselves the way that they would talk to someone that they truly love and that they want to offer support to. So, start looking yourself right in the face every day and say, hey, I'm facing cancer, but it doesn't mean that my life is over. It's an opportunity to recreate the life that I would like to have. And I have a shot at this. I have to show up for myself every day. And so having those kind of conversations with yourself, because it's so easy to say, you know what? I feel like crap today. I don't want to do anything. I want to give up. This is hard. Yep, it is hard. Yep, it is. It is crappy. But, think about the things that you can do right now in this moment to uplift yourself the best way that you can. And a lot of times it starts again up here. You have to talk to yourself the way that you would talk to a friend or a loved one.
Yeah, put that positivity out for and start with that internal work, so that way it helps. Yeah.
Yeah.
I talk to myself all the time, so it's
Right, but that's why I said the positive part, Dan. That's the positive part. Yeah.
It
Well,
helps.
Talaya, we obviously really appreciate you sharing so much of yourself with us today. And if pieces of this are resonating, or if there are those out there that are listening that may need this kind of support, where could they work with you?
Absolutely. So they can go to my website, and it's called ontheotherside.life. That's ontheotherside.life. And they can go there if they're interested and schedule a free 30-minute meet and greet. And as I mentioned, that's where, they just let me know what are some areas where they could use some support. And we'll determine at that point if it's a good fit. I'll tell them how I can support them, and we can start developing our relationship at that point. I'm also on social media. They can find me on Instagram, on the other side 17, Facebook, on the other side Cancer Doula, and all of that can be accessed from my website.
Okay, great. Well, thank you so much.
Thank
Yeah,
you for
thank
having
you.
me. Thank you. It's been a pleasure.
I thought we got there. I thought like your questions about the policies and all of those things were very poignant, and I can't imagine all the stuff she's had to go through with all of her clients, and the turmoil within their jobs and their positions during this incredibly tumultuous time.
Yeah, transition. Like no matter what, it's going to be
Yeah.
formative transition, and definitely like I just think that's where I think the relationship aspect of that particular role must be really powerful and challenging, right? Because you have to be strong in this moment for others, recognizing the adversity that they're experiencing. And so I don't know. I think even just the idea of like the healthcare aspect of okay, this is the idea of being able to like talk. Sorry, as someone who just went through like new healthcare stuff because of having a child, I'm realizing there's aspects of it that I don't understand, and like she has some things that are happening that I'm getting told, but I don't get what they are. So I can only imagine for a lot of our clients, like also that being true, where you're giving options or there's things to discuss, and it's like, who would I call? Right? I wouldn't have anyone. So yeah.
Yeah, I mean, you might not you might have family members, but they're not doctors. They don't know they don't understand the procedures, and if you could be with her and she could explain something to you, and that's to your point. She explains something to you, and it's incredibly hard because I'm sure a piece of her wants to give some sort of like, well, maybe you should do this, but she like intentionally is basically neutral. So
to go through the process of the discernment and then make sure the person what they choose, right? It's not advice giving. It's yeah.
It, yeah.
Cool. Well, I mean, definitely appreciate just her being, and it's always funny when we run into these folks that definitely are by nature, I think, just a little bit more grounded and soulful in their way. The contrast of you and I at times in terms of our voice and our manner and these things. So definitely just appreciate all that she brought and shared with us.
Yeah, and I was just really appreciate to understand her kind of position, and like you said, this niche position that you don't even know is a job until you talk to somebody about it, and then you say, "Oh yeah, that should be a job. Somebody should do that." And so
Yeah.
we hope all of you out there found this informative, and I hope that you give yourself some affirmation in the mirror today and tell yourself you're great. And until the next time, we'll be working for you.
Ciao, y'all.